Since the inception of DSEK surgery, it has become the procedure of choice for endothelial diseases like Fuchs endothelial dystrophy, failed keratoplasty, and pseudophakic or aphakic bullous keratopathy. In DSEK surgery, first the recipient's epithelium is marked in size similar to donor graft. In the marked area, Descemet's membrane is scored and stripped gently with a reverse Sinskey hook, using epithelial mark as a guide without damaging the corneal stromal tissue. After removing the Descemet's membrane, it is placed on corneal surface to check for its complete removal. Pre-cut donor corneal tissue is refined as per size, and then donor lenticule is ready for insertion. The graft can be inserted into the antechamber with a wide variety of techniques. Push-through techniques like forceps and sheets glide, or pull-through techniques like Busin and 10 endoglide. My preferred device is Busin Glide, which I have been using for many years, but every time I felt that there should be a way to make it more comfortable for myself. Looking at the design of Busin Glide, it is a straight handle device with a groove on the other side for holding the donor lenticule. While using this device, Busin Glide and DSEK forceps are 180 degrees apart, and both the hands of the surgeon are opposite to each other. Due to this, both the arms move away from the body line while operating. This causes instability of the wrist and fine movements become coarse. This happens because the elbow joint is unsupported during this step. Every joint is meant for a particular movement, and wrist joints are meant for fine motor skill movements, whereas elbow joints are meant for large angle gross motor movements. And due to involvement of multiple joints, fine movements get affected. Studies have shown that arm posture changes influences hand control. To modify this design and make it more ergonomically suited, I modified the design of Busin Glide and gave a 90-degree angulation from the handle. Separate glide for the right and left tie was attached to the handle on the opposite sides. The internal diameter of the glide was 4.2 mm and the external diameter was 4.8 mm. The plate for placing the tissue was curved to hold the donor tissue in a natural curvature of the cornea. While using this modified device, although the tip of the glide is at 180 degrees apart from the DSEK forceps, but the handle of the device is 90 degrees from the forceps. Due to this change in the design of the glide, the arm stays closer to the body line and making it more stable during the procedure. The surgeon sits temporally, and after placing the DSEK graft on this modified Busin Glide, the donor lenticule is pulled into the glide. From external view, the position of instruments can be visualized. At this point, arm stays closer to the body, providing better stability and fine control on the surgical steps. Donor graft is pulled into the antechamber with the help of DSEK forceps. Antechamber maintainer is removed and air is injected in the antechamber to provide the tamponade. Adequate antechamber pressure is maintained to ensure graft attachment. This simple and unique modification helped me a lot in donor graft insertion during DSEK surgery. To make a change, you don't need to change a lot. Sometimes little things make a big impact.